based on your question on children, a lot of people again now responding, should asthmatic children be more careful, Dr. Sibal? Are they more vulnerable in any way, Dr. Sibal?
So, any child who has reactive airway disease can, have symptoms which can be confused with COVID. So, first of all, one needs to make a distinction. Are we dealing with COVID or are we not? So, a test needs to be done, a swab. It's no different in children than from adults to make a diagnosis. And if it turns out to be COVID, then we need to manage as we would manage children with COVID. Of course, someone with, a history of asthma, has been wheezing, would be on medication, which of course needs to be continued, might need to be altered. So it would vary on an individual to individual basis. While on medication, Rajdeep, I'd just like to make a couple of comments. Quite often one sees, parents trying to extrapolate adult prescriptions. And so, okay, I have a 6-year-old, so, I'll give a third of what the adult prescription looks like. And that doesn't work because kids are not miniature adults, and we need to be particular about that. And this is moving away from pediatrics, but some of the drugs that have been really talked about, tocilizumab, itolizumab, and people keep saying, oh, these are magic, wonderful drugs. We have to realize that, yes, they have a role, but clinicians are very careful when we prescribe these because there is a downside to it. So, some of these medications that are talked about really do have a role, but in limited situations and with a lot of deliberation. So that's an important point to take home. Now, what is going to happen in the next 10 days is we're going to get the monoclonal antibody cocktail become available. And that is something that is used in an outpatient setting. When I say outpatients, of course, you need an IV infusion. So you might need to you need to come into a facility to take it. But that is to keep individuals out of hospital. So which means it needs to be given really early in the first few days. It's not something that's going to be used at day 10. So for each of these conditions, and as our panel has kind of clarified, steroids at what stage, remdesivir at what stage, other molecules at what stage, the monoclonal antibody at what stage, plasma very iffy, and so many drugs we've talked about really have no role today as we speak in May 21.
Okay, let me come to a critical issue of monitoring, because a number of people are asking questions, or there are questions swirling around monitoring. Dr. Thakkar, what is the line of monitoring that needs